Hey y'all, it's Danielle from Black Business Boom, and I am really excited to have a guest today, Ann Layman Wires from Faith Family Medical Center. We're going to be talking about Faith Family Medical Center and the amazing services that they provide here in Nashville, but also specifically about the HealthPass program. But if you are uninsured or underinsured, you definitely need to be tuned in as I'm chatting with Ann today, or if you are an employer and you have employees that you are unable to insure to the full capability, to the full, what they really need for for their insurance, please make sure that you're tuned into this interview. Hey, Ann, how are you?
Hi, Danielle. I'm great. Thank you for having me.
Absolutely. And I'm really grateful to be having this conversation with you as well as all the other conversations that we've had. I truly appreciate the work that you're doing and I'm glad to get my audience to learn more about it. So, for those that are not familiar with Faith Family Medical Center here in Nashville, tell us a little bit about it.
Thank you for the opportunity. We are a nonprofit organization. We've been in existence for 23 years. We started by were started by two physicians who had gone overseas for a mission uh, project, and they're like, "Oh my goodness, we have enough people in Nashville that need to be served." So they started Faith Family Medical Center. We serve people, as Daniel said, who work but don't have insurance, and some underinsured, meaning they have a really high deductible. We provide primary care and behavioral health. So that's as you would imagine when you go to your primary care physician. That's what we do. We do women's health. We do all kinds of examinations, immunizations, preventative care. We check to see if there are any issues and help people along their journey that they might have with their medical issues. So we're primary care, but of course we do refer people out to diagnostic testing centers, specialists, 150 different partners when our patients need additional services beyond primary care. We realize that our patients are self pay, and so those specialists and other partners, diagnostic testing centers, really provide a deep, deep, deep discount on their normal prices. For Faith Family, we charge on a sliding scale between $25 and $60, and that's for Faith Family Medical Center. So I encourage you all to look at our website. You will be able to see lots more information than I can provide, and I could go on and on, but I won't. I don't want to put you to sleep.
I love
So
it.
just
I
look at
mean,
that.
this is just it's just amazing. I was really excited to learn about what you all are providing because there are so many that are uninsured and underinsured these days. And it truly is, I feel like a crisis
Yes.
for the to not be able to get access to healthcare. Imagine, I can't even imagine because I've always had insurance, what it's like to not be able to go to the doctor because you don't have insurance or be scared to go to the doctor because of the bill that you're going to get afterwards because of the insurance that you have. And I truly appreciate coming from a medical background that you all are providing this here in Nashville. Now let's talk a little bit about Health Pass because I think this is just an amazing opportunity, especially for those that are small business owners and unable to provide an adequate level of health care for their employees. Because that's a big cost. I mean, as a small business owner, I know that is a really big cost. But then you also have those of us that have small teams or teams of contractors that we work with, and so we don't qualify for group insurance. So think this is just a magnificent way for small business owners to be able to still support their employees and and ensure that they get the care that they need. So, Ann, tell us a little bit about HealthPass.
Would love to. Thank you. So, HealthPass is Faith Family Medical Center's social enterprise. And it's been with us 3 years. I've been there since practically the beginning. I feel a little bit like an entrepreneur. And it's been great to walk that journey. And because I know there are a lot of, mostly, if not all, entrepreneurs with Black Business Boom. So this is our social enterprise. We are not health insurance. And one of the reasons, because you kind of, I mean, I get this all the time. People are like, this is too good to be true. Is this true? I'm like, it is true. We have a very low per month per member for HealthPass. I'm going to start with what we call HealthPass Primary. That is for employers to pay $38 per month per participating employee for their employees to come for their primary care at Faith Family. And the employee only pays a $10 copay every time they come here. I mean, that's phenomenal. It costs Faith Family Medical Center $234 every time somebody comes in Faith Family Medical Center. And the way we can provide these low prices, because this is our mission to improve the health of employees and help employers now, we can do that because we raise about $3 million a year through grants and individual donations. So that's how come it's too good to be true. Well, is it? No, it's true. So that is primary, HealthPass Primary. We have $20 per month, per member per month, and that's per employee that wants to participate for HealthPass Portable. That's for discounted dental, discounted vision, discounted, and we've just added a telephonic employee assistance program as a part of HealthPass Portable, as well as a couple of other items, not the least of which is telehealth, teledoc. I got it now. Teledoc, where people can access board certified physician 365 days, 24/7. So that's that. And then there's the whole shoot match for only $50 per month. So that's HealthPass Premium. So I encourage people to learn more. Oh, so sorry. And there's a lot more to learn that I would love to share. So sorry. I turned it off earlier.
Oh, you're fine.
Oh, this is live. Can you tell it's live? But and love to give a tour, talk with you, meet you all where you are that you'd like to learn more. And it's important to note that it's very. It doesn't matter if you just have one employee that you want to provide this for, or 30, however many. But this is. I even have monopreneurs who they're a part of it, and they are the actual people who are participating. So they're just so many. We have 24 partners now, both business and nonprofit. So, Danielle, I could go on and on and on, but people don't want me yet to go on
No,
and on.
no, but I think it's just so amazing. Again, I know many small business owners that cannot adequately insure their employees. And you feel bad about that. Like, you want to, that people need this. Again, and even as a small business owner, as a solopreneur, having a small team, you either have to kind of go through the marketplace, which can be really expensive.
Right.
Like there. So this is just an amazing opportunity for those of us that are small business owners. I think it's very innovative
Thank you.
of you all to offer this, and it's such a reasonable cost for us that want to offer this for our employees. So if someone's tuned in and they are an organization or an employer and they're interested in learning more about Health Pass to be able to provide this as an option for their employees, how can they do that?
Well, the best way is to call me so I can talk with them and visit. My phone number is 615-649-3039. That's that, and I'll be happy to give my email address. It's rather long. A Laymanwires at faithmedical.org. Long one. So ALAYMANWIRES at faithmedical.org. So those are the best ways.
If you want to learn more, you can always go to faithmedical.org to learn more as well. There's also a contact button there on the site, so that's an easy way for you to get in contact. again, even beyond Health Pass, I just love the work that you all are doing. I think that it's amazing for folks to have a option to use sliding scale to get access to the care that they need, as well as you mentioned, the partners that you all have that offer a deep discount for you to see specialists and get diagnostic testing and other things.
Hmm.
Amazing. And I greatly appreciate you so much for joining me and talking to my community about this opportunity for them to get the care that they need, as well as all the other things that you've been able to do for me in the short time we've known each other. And so I really, really appreciate you. You all, please reach out to Ann should you have any questions. If you missed her contact information, feel free to reach out to me and I'll get it to you. Yes, thank you so much, and thanks for
Yay!
tuning in, everyone, and have a fantastic evening.
Thank you. Thank you, Danielle, for all you do. Thank you so much. Bye bye,
Yes,
everyone.
thank you.